Hello and welcome to today's show. I'm really excited today to interview Dr. Ryan Cedermark. Dr. Cedermark is a doctor of chiropractic with a diplomate in neurology, and he's been trained by the two top minds in the world, I believe, in functional neurology, Dr. Brandon Brock and Dr. Datis Karazian. Dr. Cedermark also has a Bachelor in Nursing Sciences from Duke University, and he's currently getting his family nurse practitioner degree from Georgia State. He has spoken at the World Conference of the International Association of Functional Neurology and Rehab on gut-brain axis issues, and he's spoken on brain health summits online on gut-brain axis and traumatic brain injury. So you are in for a treat today from one of the neurological ninjas, one of the best neurological ninjas out there. Dr. Cedermark, welcome to the show.
Hey, thanks for having me, Dr. Bartemus. This is awesome.
You're welcome. And for those listening on the podcast, if you'd like to see Dr. Ryan's handsome face, then check out our YouTube channel, youtube.com/accelerateChiro, or search John Bartemus on YouTube, and this will come up. We're recording a video as well. So if you like video, check out YouTube. If you like the audio, check out the podcast. So Dr. Ryan, I'll just call you Ryan from here on out.
Perfect. Yeah.
Why so much schooling? Why the chiro to the neuro to the nurse practitioner?
To be honest with you, it kind of started out when I was in undergrad. I just really was a little bit lost. I didn't really know what I wanted to do, but I always kind of envisioned myself being in a profession to help people. So, when I got towards the end of my undergraduate degree, I couldn't figure it out. I didn't know what to do. One of my good buddies, who's a chiropractor.
All right, so we're having a little technical difficulty here. Lost Dr. Ryan for a moment. So the internet gods are trying to interfere with us, but we will not let them. While we wait for them, Dr. Cedermark and I have worked. Oh, here he is.
Sorry.
That's all right.
I'm like literally sitting right by my router, so I don't know.
There's some dysphonesis going on.
There you go. Well, yeah, just to keep it short. So one of my good friends got me into chiropractic. While I was there, I had a couple family members tell me, "Why are you going into chiropractic?" They're all like medical doctors. And I was like, I don't know. I think it's great. It makes a lot of sense to me. It's kind of in line with my vision of what health is. So when I was there, we're taught a very holistic way, and I had no knowledge of what medicine was and what it could do for people. And sometimes you hear like, "Oh, medicine's bad," and so I just have to figure it out for myself. I'll take everything that I hear with a grain of salt, and then I'll just go down some sort of rabbit hole and try to learn as much as I can about it. But I met Dr. Brandon Brock, who's one of your good friends too, and mentors. And I heard him speak at a neurology conference after I'd gotten into the neurology side of chiropractic. And the way that he spoke and the way he was able to provide care for his patients was, again, in line with what I wanted to do. So I was like, hey, this guy's doing it. I'm going to make this guy my friend. So I started bugging him a lot. And after I graduated school, I applied to some nursing programs, got in, and I'll finish in May with my nurse practitioner. So it's been a journey, but it's been pretty amazing, man.
That is awesome. And in my opinion, watching you and Dr. Brock, it's awesome because you're cross-trained and you don't run into obstacles that, say, myself with a chiropractic degree does have. So for example, as a nurse practitioner, you can put a person on medications or take them off as needed. And that can be an obstacle to me where I don't have that degree. And so when you're working with, say, gut-brain axis or traumatic brain injury type patients, they may need some medications at certain times.
Absolutely. And then, in the chiropractic profession too, I was really exposed to the functional medicine side of things. So being able to combine the medication side of things with the functional medicine side of things, because ultimately, my philosophy is kind of what I learned from Dr. Brock is whatever is best for the patient and what works for the patient. But I don't feel like medication is getting to the root cause. I think functional medicine does an amazing job of getting us closer and closer to it. But then I think when you throw on top some functional neurology and some rehab, that's when you start to really see things start to make a lot of sense, and get people better. So yeah, it's cool. Yeah.
So would you say this is the future of healthcare?
To me, it is. I think what we're doing, I think functional medicine, even though as well known as it is, especially within our community, it's still very new for people. I know that you put out some amazing content, which is so good for some people, because they're like, what, you know, this is bad for me. I've been eating this my whole life, or I don't need to be on my blood pressure meds my whole life. Oh no, it's, you know, so I think it is. But I really do think if we can get the functional medicine community and the functional neurology community to really start to blend things together, that's what I see being the future of healthcare. It's just, it can do some amazing things for people, like I'm sure you've seen in your clinic.
Yeah, I agree with you, and that's why I went the functional neurology route to layer it on top of the functional medicine, because you know, you can have primarily metabolic issues that drive neurologic symptoms, or you could have primary neurologic issues that drive metabolic symptoms. So it's kind of the brain gut brain loop. Which end is perpetuating the other? And ultimately, with plasticity, they could be both perpetuating each other after a certain amount of time.
Yeah, exactly.
So what are you've been seeing quite a few brain gut axis type clients lately. Why don't you explain to the listeners common symptom patterns that could be a clue to them that, hey, your GI distress isn't necessarily a GI issue, but it's more a brain gut issue or a brain trigger.
Cool. Yeah. So it's crazy because when I was in nursing school, I had gone through the neurology program and I had gotten my diplomate, but literally as soon as I had gotten it, they started doing a traumatic brain injury course. And it was kind of all based on Sidney Crosby, who suffered two really.
So Dr. Ryan broke up for a second, but he's referring to Sidney Crosby, the hockey player that suffered from two really bad concussions. And the functional neurology program at Life University in Atlanta, Georgia, worked with him to help rehab him and get him back on the ice. And so that led to, you know, more national media attention to traumatic of the program.
Sorry.
So, hey, that's okay. So we were just talking about how you graduated school, and right when you graduated and got your diplomate, Sidney Crosby had his concussions, and the functional neurology was key in getting him back on the ice.
Right. And so that kind of led to this influx of people with head injuries or concussions that needed functional neurological rehabilitation who hadn't really gotten better with your standard like physical therapy or occupational therapy or just standard rehab. So we started seeing all these patients, and then, you know, the patients with concussions also had complaints. We used some forms, you may use some similar forms just to kind of do a general screening of their entire body. And we started to see a lot of complaints with gut issues and with metabolic issues in general. So some blood sugar issues, stuff like that. So basically, I just started getting into and looking into what's going on with the brain, what's going on with the gut. And around that time, Dysfunction Karazian published a paper. This is in 2015, traumatic brain injury in the gut-brain axis, and that just like opened up the world to me of learning this stuff. So what I wanted to learn is how we could figure out how to, first of all, what came first, the chicken or the egg? Were there all these metabolic issues that primed the system and put them at risk for a concussion? So if they had a head injury, they'd suffer all this other stuff, or vice versa? Does the head injury cause all these metabolic issues? So we figure that out by doing an exam in the history, and then we start to do rehab. And that's for me where we see like the most dramatic outcomes.
Gotcha. So I'm just going to share the screen here and show the folks what you're talking about. And it's actually right from your Facebook.
I need to post more on that page.
Yeah. So this is what Dr. Ryan's talking about. And can you still see this, Ryan?
Yeah.
Okay.
This is awesome. So this is one of the two of my favorite images from his paper. But
why don't you just walk us through it a little bit? So from this left side here, from the brain heading down to the gut, and then we'll circle back gut to brain. And you don't have to get all super nerdy with the terms and everything, but just from a patient point of view, how you're explaining it to your patients.
So basically, for me, the brain is controlling everything. And when there's dysfunction somewhere, there has to be dysfunction with the brain. But as you guys see in this image here, it talks about the vagal nuclei and the nucleus tractus solitarius. Those are areas in the brainstem that are responsible for helping the brain communicate down into areas in the rest of the body and the gut. So these are just pathways. And to keep it simple, if there's dysfunction in brain, there's a pathway that can lead to dysfunction in the gut. And then also if there's dysfunction in gut, there's a pathway that can lead to dysfunction in brain. And those pathways can be nervous system pathways. They can be pathways that are inflammatory pathways. They can be pathogenic pathways. So it's really pretty amazing when you start to learn this stuff, and then being able to apply rehab to help these systems work better after injury. But yeah, this image is great, and there's so much more research out there. And Dr. Karazian wrote this paper. I spoke with him and his wife about this. He wrote it on like a napkin while he was like riding a train in France. He like basically wrote it out, and it's a summarization of other articles. But what's really cool about that paper and about what we're doing in functional neurology is other professions are looking at us. So when I was getting ready to do a presentation in Las Vegas this past year, I was researching traumatic brain injury, and this one paper, these guys that wrote a really, really great article referenced the thesis paper like 4 times. So, that for me just speaks so highly of what we're able to do and the work that we can do with the other patients. So, but yeah, that's a great image. The other one's really cool too, where he breaks down like all the different areas of dysfunction. But
yeah, and it really is. And you froze again. So while you're there he is. Yeah. You there? Okay. So why don't you dive in?
I'm like literally sitting next to my router. I don't know what's going on.
Yeah, I'm gonna have to call the company and see what's up.
I've got my internet has functional disconnection syndrome. So sorry.
So with you just explained how brain to gut to brain can drive issues. So let's boil it down to specific issues for certain patients. So there's lots of research coming out on the gut-brain axis as it relates to neurocognitive issues like anxiety and depression, and how many patients have anxiety and depression. That walks into our office all the time, okay? And many of them have been to psychologists or psychiatrists reporting these symptoms, and they're given an SSRI or something similar, and it helps for a second or it doesn't help at all. And so eventually, they're labeled as it's in their head. But I don't know if you ask your patients, but I always ask these patients, have they ever asked you anything outside your brain? Like, do they ever ask you if you have gut issues? And they look at you kind of weird, like, no. And it's like, if they go to their gastroenterologist with chronic gut issues, do they ever ask you, hey, do you have any neurologic issues? No. Why would the gastro ask me about neurologic issues? Well, it's all connected. So how should patients with anxiety and depression that isn't being helped by typical mainstream methods, what should their next step be?
I think that's a really good question. And for me, like, just to keep it simple, what I tell people is your brain tissue is nervous tissue, but it's immune tissue. Mm-hmm. It's made up of these amazing cells that are immunological in nature. So when you have immune dysfunction coming from your gut, or you have all these gut related issues, they're going to affect brain. So what I would say is, anytime there is a brain issue, you've got to kind of like look back and do kind of like a self-reflection on how is your diet, how are your stress levels. All that plays a major role, because to me, they're right. It is all in your head, but it's not originating in your head. It's coming from somewhere else, and it's just being manifested in cognition and other symptoms. So my biggest thing is just keep the perspective of your brain is your brain, and your brain's an important nervous system tissue, but it's also immune tissue, and it's affected by immune dysregulation.
Yeah, and I would argue that, when they tell you it's in your head, they're right, but for the wrong reasons. They're saying it's exactly in your head because you've reached their limit of knowledge and they just want you to go away.
Exactly.
But it's literally in your head physiologically and neurochemically because of something else going on in your body. So like Ryan just said, it could be because you're eating, a pound of gluten a day, which is destroying your intestinal barrier, causing systemic inflammation, which then becomes neuroinflammation and drives those anxiety and depressive symptoms.
Mm-hmm.
No amount of SSRI is going to fix what the gluten is doing to your gut, and the real trigger is, in this instance, the gluten, right?
Right.
So it's more of a holistic picture. Again, if you're not getting the results you want or expect or need for your what looks like a neurologic issue in anxiety and depression, then we have to look elsewhere and say, what's below the head that integrates into it that could be driving it?
Exactly. Yeah. I think that there's that book that I think that guy Michael Gresham wrote, The Second Brain. And he speaks about the gut. And, to me, I think the gut is it's so important. There's so much diversity in there. There's so many things that could go wrong. So just like you said, if there's anything that's wrong neurologically, I think that the gut needs very special attention. And if the person that you're seeing isn't looking at that stuff, or they're just prescribing a medication and saying, all right, and they're treating symptoms, you're never going to get better. You're losing, you're losing the communication there. You're losing the proper communication. You're losing the fuel. You're getting increased inflammation. And then, once your brain starts to go downhill, you can't make the right decisions. You can't have positive outlook. So everything just goes into a vicious cycle. So yeah, big time for me is looking at gut.
And so gut is a driver in many of these cases, but you could have a traumatic brain injury driven
yes
etiology as well. So kind of talk about that some.
The perfect example of this is a young girl that started coming to our clinic last year. She had been basically everywhere. So she had a history of concussions, but she was okay. She was able to function after.
Okay, you froze for a second, so we really want to get this history in. So when Dr. Ryan comes back, we'll restart with this case. But in the meantime, traumatic brain injury through research has been shown to cause leaky gut within 3 hours. So again, when we're talking about brain-gut, gut-brain axis, if you've had a traumatic brain, you can perpetuate it. So
I swear I paid my internet bill. I don't know.
So we were talking about the young girl that came in.
Yeah, so she had been everywhere. Well, first of all, she had 3 concussions, the last putting her into a downward spiral where she basically couldn't eat any food. And by the time she'd come into our clinic, she hadn't eaten a full meal in over a year.
Wow.
And in that time, she had been to her primary medical doctor, a gastroenterologist, and functional medicine. And I think the combined efforts of that, the conclusion they came to was to start her on what's called an elemental diet. And so if no one knows what that is, it's just basically a way of getting some nutrition into your system that is not very demanding of breaking down and stuff for your body. So to me, it looked like she was just basically drinking a powdered substance 8 times a day just to stay functional. So by the time she got into our clinic, she just looked totally emaciated. She was pale. She had no energy. And we did our neurological exam and found out she had a lot of underlying vestibular issues because of the head injury. And we were able to do therapy for a few days. And usually what I like to do too is I like to put in people's heads, what's your goal? Where do you want to be? And her goal was just to feel better. She didn't even have on her radar that she might be able to eat a solid meal again. So I said, hey, I'm going to make you a bet. I want to make a bet that, what's your favorite food? And she's like, bacon. And I was like, I want to make a bet that you can eat bacon by Thursday. And she's like, okay.
Wow.
So we did all this functional neurological rehab while making sure that, she was very nice to her immune system. So keeping all the food stuff out and continuing the elemental diet. And by Thursday, we reintroduced food and she started to eat. And by the next week, she was able to eat a full meal. And now she's eating 3 full meals a day.
All made up of bacon?
all bacon related foods. No, that was her goal was initially bacon because I eat meat and man, I love bacon. So
yeah. So that's amazing. And that's someone who probably before they came to you guys was had no hope or had lost all hope.
Yeah, she had, and she'd done like all the right things nutritionally. I guess the point of that story for me was this a neurological issue, or was it a nutritional functional medicine issue? And I think it was both, but I think we had to basically overcome the neurological issue first, recreate positive plasticity in those pathways for communication between brain and gut, and then start to reintroduce healthy, good foods for her system, but neurologically first.
Because she couldn't eat those foods because the brain's ability to drive motility, drive secretion, drive digestion was missing because of the head injury.
Yep. And she had some immune dysregulation. So, once we got that all figured out, we started to notice that she had a lot of immune intolerances too. So we had to help fix immune system. But yeah, we had to help brain gut big time first.
So that, when you broke up a second ago, I was speaking about a study. I don't know if it actually caught it on the recording or not, so I'll bring it back up. But the study that I know you've seen, because Datish and Brandon showed it plenty of times, but it's the study of looking at rats, and when they induced traumatic brain injury, within 3 hours they have leaky gut.
Sunman et al., man, that's one of my favorites.
Yeah, and so in her case, it's likely she had 3 TBIs, and then her gut was a mess. So what I was saying while you were gone is, even if you haven't had traumatic brain injury to the extent that she had, say you had mild TBI, or say you had a concussion, many people think when the concussive symptoms are gone, hey, I'm healed from it. But if you have a concussion, within 3 hours you may have GI issues, and even though the foggy head goes away, doesn't mean the GI is healed. And could that GI perpetuate neurologic issues? And you froze before I finished the sentence. So we'll wait for him to come back. But the answer is yes there. The answer is, even though the concussive symptoms are gone, the GI may not be healed. And now we could have a gut-brain loop where the gut is driving brain issues.
Oh, sorry. Did you guys?
You were frozen. I didn't get your answer.
Oh, sorry. So that was Basil et al. I remember those guys. They wrote 2 different articles, and those are amazing. But yeah, basically that just proved to me that brain gut brain. There's alterations in intestinal lining and the tight junctions when you have basically injured communication between brain and gut.
So how often do you see the need for medications in these cases?
That's a good question. For me, I'm not licensed yet as a nurse practitioner. So I'm always looking. Medication for me is always the first thing I look at, because I like to make sure that what I'm seeing neurologically isn't a side effect of their medication. So are they orthostatic hypotensive because of some vaso dysregulation, or is it because of a side effect of a medication? When we look at eye movements, I like to make sure that they're not having hyperactive saccades because of some sort of stimulant that they're on or stuff like that. So I always like to make sure we look at medications, but honestly, I feel like you could do so much without the medications to help rehab these people and treat, because we have an internal pharmacy. We really do. We've got a lot that we need. Sometimes we need a little bit of exogenous help, but if the brain and the gut and everything's working at least 90% of what it should be, we should be able to do a lot of good things without the need of medication. And that's not true for everyone. Sometimes we need it, which is why I wanted to do the nurse practitioner route. But I feel like the majority of cases just don't need medication, and that's where we're failing as a healthcare model in our system. We're failing ourselves, and we're failing everyone else, because we're prescribing medications and then we're not following up with patients. We're treating side effects of other medications. We're not implementing proper lifestyle changes. And I don't know. It's just I don't think you need it that much. That's just my personal belief, but.
Well, it's a personal belief, but I believe that belief is driven by experience, and I'm sure your experience in the Emory system has reinforced that belief.
Oh yeah, man. Yeah.
So my question would be, and an awesome study would be, how many of these patients that you're seeing as from the nurse practitioner role in the Emory University healthcare system that are getting all the meds and not getting any of the functional medicine or any of the functional neurology? Are you kind of tortured every day? I know I could just give this person some X supplement or do this eye rehab exercise with them and make them better than whatever they're receiving here?
Yeah, like I actually, so like working as a bedside nurse at the hospital, so I worked on a post neurosurgical floor. So a lot of patients came in with stroke, head injury, brain tumors. So they need rehab, but in the hospital, physical therapists are amazing, but they're very busy and they're, they can only spend a certain amount of time with patients. The rest of the time they're spending just literally laying in their bed, totally unstimulated. And I actually wrote a paper, when I was doing my BSN in North Carolina. I wrote a paper on the necessity for having a stimulating environment post-stroke. So post-stroke patients or anyone with neurological conditions, they go to a specific unit. It's just a unit, but they have the ability to leave their room and go engage in some stimulating physical activity. Even not stimulating physical, just have the options of listening to headphones, having proper visual stimulation in different areas for different brain stimulation. So I wrote a paper on it, and like whoever I had as a professor at the time was like, "This is amazing." I was like, "This is functional neurology," like, and I don't know, but yeah, it's frustrating. So I would sneak in and do like complex movements with patients.
Right.
I have some patients gargle. I do different sensory stuff with them, and I think, even if we could just implement that as a bedside nurse, I think it's pretty cool because, the brain needs activation. Without it, it dies. So
Yeah, like if you could just get the system to implement, Neuron Theory 101, brain needs fuel and activation, right? So just cleaning up the fuel instead of turkey on white rice and Jello, like give them, or white bread and Jello, give them some real nutrition.
right.
And then the stimulation would be the neuro. You're here. The stimulation would be the neuro rehab. If we got crazy, with some simple neuro rehab, or how about, hey, let them walk down the hall, let them go have a community room for these people. You know what I mean?
Yep. Actually, and that reminds me too. This was probably the most disheartening thing I saw in the hospital. And the hospital is amazing. It's just some of the stuff that we do in the healthcare system is outdated because it's all evidence-based, and evidence-based is like 10, 15 years the latter. So it's like, oh my gosh, what are we doing? We had this like 21-year-old with a history of ulcerative colitis. And I don't know if you knew this, but now they're giving chemo for ulcerative colitis. And so we were giving, sometimes we were a floor that we were trained in giving chemo. So we would give chemo to a 21-year-old with ulcerative colitis. I'm just thinking to myself, while she's eating, the food that we're providing, and it's just like, oh my gosh, this is so bad. But,
Yeah, you gotta just give them your card. Be like, when you leave the hospital, call me.
That may or may not have happened a couple of times. But.
Oh man, well, awesome. So what's next? You graduate in May, and then where do you go from here?
So I'm doing my final. I live in Atlanta, Georgia, and I'm doing my final rotation with a functional medicine MD. So she has a really cool practice. She does a lot of functional medicine, and when we refer back and forth a lot of patients, I see a lot of her neurology patients, and then I'll send some functional medicine people that I'm struggling with to her. And my goal is to eventually, eventually work with her in some sort of capacity, so I could work as her nurse practitioner, even if it's not on site with her, because, I also get to work at Life University, where functional neurology is becoming pretty big there. We're starting to implement a lot of stuff. We have a clinic on campus and then one in Midtown Atlanta, and we're also doing research for functional neurology. So I really like to be involved with that. So, the goal for me is just to help be a resource for people in the community that I can provide this type of care for, because I don't project us getting healthier as a society the way things are going right now. And, we need people in the community to shift mindsets, to be able to implement different types of healthcare strategies. And I think what we're doing, it's a biased opinion, but I think it's what needs to be done. So
I agree.
Yeah,
So I'm not really surprised, because you can't pin you down to one degree. So pinning you down to one clinic will probably be hard as well.
Well, I don't really know. I'm still trying to write it out. Like every morning I write out, like, what the heck am I going to do with all this? Like, I don't know, but like, I've met people in my life where it's like, okay, this could make sense. And, I don't know.
But I think the answer may be don't pin yourself down to one, because I think that I'm pretty sure the statistics are by 2030, we're going to be at a 52,000 physician deficit in the United States. And so
I didn't even know that.
Yeah, it's snowballing really bad. And that's across the board. And so
sorry, my wife just came in with her baby on her belly.
Nice.
And no, so I didn't even know that was a statistic. So that drives me even more to know that now.
Yeah. So we need clinicians that know the functional medicine, know the functional neurology, are cross-trained. But even if we all establish our own clinics, there's still not going to be enough. So having a voice out there like you that, yes, you bounce around to different clinics and have your hand in each of the specialties you have, but also being at a life university and steering these kids and adults away from don't do chiro only. It has a role, but you could affect so much more. You can make such a larger positive effect and fill a greater need if you were cross-trained in these other areas. So the fact that you're there saying, hey man, I've been out, but not for too long. I've accomplished these things and look what we can do. That's powerful.
Yeah, thanks, man. I mean, that's my goal. I don't like to my personality. I just like to do, and then hopefully people will see. And sometimes, I like to jump on the social media just to spread the word, but that's my goal. I want, it's tough. Like when I talk to some students, they're like, they think it's so.
You froze. I think I know where you're going with the student talk, though. I think what he's saying is students in school are so focused on the next quiz, the next test, the next midterm, that they don't realize they become the clinician outside of the classroom. And when I was in school, that's what here he is. That's all right. I was just saying, I think where you were going with that was students are always focused on the next quiz, next midterm, next test, and they don't realize you become the clinician outside the classroom. So don't say, oh, I'll do the seminars once I graduate. It's like, no, do them now, because that's what's preparing you. Board exams you're going to pass, and then it's over. You have to become the clinician now.
Yep. Yeah, that's great. That's great advice. I mean, what's cool about what we do, this was amazing. So I got a phone call one day and it was like, hey, I want to be a functional neurologist. And I was like, what? And there's this young guy from Michigan. So he's actually people are starting to look like, I guess he had met some, you meet someone that's doing functional neurology, they helped your family member. And now it's like, I want to learn functional neurology, which is crazy to me. So, it's cool because now this young guy, he's coming down to visit the school in January, and I'm going to show him the clinic, show him some of the stuff we do, and just help spread the word, because that's the goal. So
yeah, so you're going to be his Brock.
Oh gosh, I don't know about that.
You're passing the torch.
It's so funny, man. I don't know if you've experienced, because you're super duper smart. I love your post, by the way, but every time I read something, I'm like, crap, there's so much more to learn.
Oh yeah, but that's the exciting thing, because I think if we knew it all, it would get boring.
That's true.
So it's exciting. To me, it's exciting because I know I'm not going to know it all ever, but that's cool because I'll always have something to do. You know what I mean? There's always a deeper rabbit hole.
And I don't know if you remember this, but I was out running this morning. I thought about this before we jumped on here. I met you actually my first year in school, and we only spoke very briefly, but you were talking to me about auriculotherapy and how you're helping your patients with auricular therapy. And this is just an example of this. I was like, what? I'm not interested in that. That's crazy stuff. But that's pretty much half the stuff I do with patients now. It's not specific auricular therapy, but I learned about acupuncture meridians, and I'm learning all this stuff. And I'm like, why didn't I know this for all these other patients before? So, I don't know. It's pretty amazing. And you're the man, dude. I really appreciate everything you put out and all the work you do, because you work your butt off and you have 4 kids. So I don't know.
Well, thank you. I appreciate that. And so if people want to reach you, find your content, be a patient of yours, how do they get a hold of you?
So best way to do it is actually, I have a Facebook page where we talk about neurology stuff. So which you're going to be on soon, hopefully. So you can just message me on Facebook directly, or I can put out my email somewhere on the link here. And my email is just dr for doctor and then Cedermark, my last name, @gmail.com.
Okay, I'll put that in the show notes if that's cool.
Yeah, of course. Yeah. And email me directly. I'll get back to you as soon as I can. And check out our brain chat page, because I'll have Dr. Bartemus on here soon, because I have some questions for you.
All right. Sounds good. Well, thank you so much for taking time out of your busy life with your newborn boy.
Yeah, thanks, man. Thank you for having me. I'm sorry for all the internet issues. I don't know.
It's all good. It was worthwhile. So you have a wonderful day, and we'll be talking soon.
Definitely. Thanks so much.
All right.